Today, nearly 1 million patients are treated in the operating rooms, clinics, emergency rooms, and offices of Lee Memorial Health System. More than 10,000 employees are dedicated to serving the men, women, and children of Southwest Florida. Nearly 5,000 volunteers and auxilians donate more than 500,000 hours each year. The numbers are astounding, but even more so when you realize just how it all started 100 years ago. The very first patient of Lee Memorial Health System was a man with appendicitis from LaBelle named Sam Thompson. In the fall of 1916, Thompson had his appendix successfully removed in Fort Myers' brand new hospital. The surgery was performed by Dr. Daniel McSwain, who took a train from Arcadia to save Thompson's life.
He would travel all night, come down to Fort Myers from Arcadia by train, do surgery, and then jump right back on the train and go back to Arcadia and start his day all over again. A caring man, caring for others. He sort of helped build that legacy of caring people, caring for people.
That first hospital, located at the corner of Victoria and Grand, was a modest 2-story building with just 4 patient rooms. Plans for that hospital were first born 4 years earlier in 1912. Then, the town of Fort Myers boasted less than 3,000 residents. Fort Myers was booming, and a group of civic-minded citizens decided that their town needed a hospital. They set about raising support, and of course, money. What followed was a few years of on-again, off-again negotiations, collaborations, frustrations, donations, and most importantly, dedication. In 1914, the Lee County Commission voted to build a new courthouse. After volunteers dismantled the boards of the old wooden courthouse, the lumber was set aside to be used to build a hospital.
The story of the hospital being built from recycled lumber just shows the resiliency and the drive of the people who felt that a hospital needed to be built, and it's just a terrific story.
But boards and drive weren't enough. They still needed money. Money came in from various sources, and by October 1916, the newspaper reported that the hospital would be opening within a week. The new hospital was first named the Lee County Hospital. It would later be renamed the Robert E. Lee Memorial Hospital, and finally shortened to Lee Memorial Hospital. In 1922, Theo Ellis became the hospital's first operating room nurse. She remembers that the hospital had 25 beds, instruments were sterilized using a wood-burning stove, and nurses chopped the wood. At this time, the all-female nursing staff worked 12 hours a day, 6 days a week, and they were paid $85 a month.
And then to sterilize the instruments, you had to sterilize them on the kitchen stove downstairs. And a lot of times I had to rekindle the fire. I had to cut the wood for the first instruments I sterilized.
It's important to note when telling the history of Lee Memorial that, like the rest of America, Fort Myers was very much segregated in the 1920s. There were no black doctors or nurses, or even patients at Lee Memorial Hospital. Starting in 1924, medical care was available for blacks at Jones Walker Hospital, located in what is now Dunbar. Jones Walker remained open until 1966, when Lee Memorial Hospital was integrated.
As a young girl growing up in Fort Myers, I remember Jones Walker Hospital. I finished Dunbar High School in 1964, so Jones Walker was still there 2 years later. My brother was an orderly there because his goal was to be a doctor. We still have Mildred Johnson. Mildred still works as a sitter for Lee Memorial,
yes.
And Mildred is the only person that transferred from Jones Walker without a break in her service to Lee Memorial. One of the things that I remember as a girl, because it was the hospital, so you didn't think about coming over, to Lee Memorial, although you knew it exists. I remember when it was even on Grand that it exists. However, one of the things that would happen, Roger Scott was one of the main surgeons that was always over at Jones Walker.
But back to the 1920s. In 1926, the hospital was incorporated, and its mission set in the board minutes as follows.
The general nature and purpose of this corporation will be charitable in its inception and not one for profit. It proposes to provide a hospital and furnish same with such appliances and accommodations as will give to the sick and afflicted, wounded, or diseased such attention and treatment as may be necessary.
In 1939, the hospital's future began taking shape on Cleveland Avenue, near Fort Myers Country Club, with financial help from the Federal Public Works Administration. Work began on a new $200,000 hospital building where Lee Memorial Hospital is located today. No longer a tiny hospital in a modest wood frame building in a small and remote city, Lee Memorial was becoming a big city hospital. The new hospital on Cleveland Avenue opened on April 18, 1943. The news press lavishly covered the big news of the hospital's new home with front-page stories. A reporter described the new hospital.
That new hospital out on Cleveland Avenue is just about the nicest place imaginable to be sick in. It's got just about everything, from magnificent sun decks to a cozy parlor where you can play cards in front of a log fire on a chilly evening.
Though in 1943, with no air conditioning and an ambulance driver who also worked in the machine shop, things were still relatively crude, at least by modern standards, and it didn't take long for the community to outgrow the hospital, which was bursting at the seams by the early 1950s. A man from one of Southwest Florida's most prominent families was recruited to spearhead raising $500,000 for a hospital expansion. That man was Connie Mack Jr., son of the Baseball Hall of Famer, who brought the Philadelphia A's to Fort Myers for spring training in 1925. In 1955, one of the most influential figures in Lee Memorial history was hired as administrator. John Gadd came from Vanderbilt University Medical Center, and he would run Lee Memorial Hospital for the next 26 years. One of his first major milestones was overseeing the completion of the new expansion. An ad in the news press on February 19, 1956 proclaimed, dedicating the completion of a $560,000 expansion program, the largest and finest in South. Dr. Roger Scott came to Fort Myers to practice at Lee Memorial during this time.
They were scary times. I did operations that I had never done before. I did the first vascular surgery here in Fort Myers. I had to buy my own instruments.
The new expansion brought the number of beds to 100, but the architect who designed the building predicted that in less than a decade the hospital wouldn't be large enough. He was right. In 1962, hospital directors unanimously approved building a 300-bed hospital on a new site. In 1963, Lee Memorial Hospital went from being a private hospital to a not-for-profit public hospital with a community-elected board of directors. The news press published a special section in 1968 celebrating the $5.5 million project.
The opening of the new Lee Memorial Hospital represents another milestone in the development of Lee County.
By the final 3 decades of the 20th century, the way things were in 1916 when the hospital first opened started to sound not only quaint, but also nearly as ancient as operating without anesthesia. Medical advances, such as arthroscopic surgery and open heart procedures that would have seemed like science fiction in 1916, became commonplace in the late 20th century. Lee Memorial Health System was part of that medical revolution. By 1970, the county's population had nearly doubled from 10 years earlier, and it would nearly double again in the next 10 years. By the end of the 70s, a study prepared for a hospital administrator reported 130 items that the hospital now had that it did not have in 1955. The list started with accreditation and ended with doctors' offices. By this time, other hospitals were springing up around Southwest Florida, from Lehigh Acres to Cape Coral, and Lee Memorial Hospital knew they needed to continue improving and growing. One of the most significant people in the hospital's history was hired in 1975 as an administrative resident. Within a year, the board promoted him to Vice President of Institutional Services. That young man was James R. Nathan, who is the system's current CEO and president. He replaced John Gadd, and both men oversaw enormous change and growth. The rate of growth didn't slow as the century was nearing its final decade. Lee Memorial expanded services in numerous ways, including opening outpatient facilities, bringing care to convenient locations, and opening family medical centers. The 1980s witnessed more expansion of services. Lee Memorial Hospital opened a cardiac catheterization lab, a wellness center, as well as a neuroscience and stroke center. As the 1980s wound down, Lee Memorial was nearing the opening of a second hospital, a most extraordinary facility, a unique showcase of architecture, art, and medical care. Health Park Medical Center opened in 1991. It took 3 years and $56 million to make it a reality. The new state-of-the-art hospital had 220 beds. 75 of the new beds were dedicated to pediatrics and became the Children's Hospital of Southwest Florida.
I was president of the medical staff then when we had the groundbreaking, and I remember driving down here thinking, where are they putting this place? It seemed like it was truly in the middle of nowhere, and I thought Jim Nathan had lost his mind. But if you look at the area now, obviously he was a visionary of what this means to this community.
Lee Physician Group was established in 1994 and is now one of the largest physician groups in Southwest Florida, with more than 300 employed physicians. In 1996, Cape Coral Hospital joined what is now being called Lee Memorial Health System. And as the 21st century beckoned, Lee Memorial Health System was positioning itself to grow again. The magnitude of care provided by the health system at the dawn of the new millennium was staggering. In 2000, more than 440,000 people called Lee County home, and the system cared for more than 38,000 adult and pediatric patients. In 2006, Gulf Coast Hospital and Southwest Florida Regional Medical Center were merged into Lee Memorial Health System. The newly expanded $285 million Gulf Coast Medical Center opened in 2009. Work has steadily progressed on building the $244 million Golisano Children's Hospital of Southwest Florida. Naples billionaire B. Thomas Golisano donated $20 million to the project. The community came through once again, and by the summer of 2015, the Golisano Children's Hospital was halfway finished with a grand opening set for 2017. The 21st century has projects for future growth, as well as to keep pace with the needs of a growing community. In 2014, Lee Memorial Health System announced plans for a $140 million health campus in South Lee County in the village of Estero. In early 2015, Lee Memorial Health System began planning for a 275-bed addition to Gulf Coast Medical Center. So much has changed in 100 years, but one vital ingredient of healthcare remains the same. Back in 1914, citizens dismantled an old courthouse and saved the lumber so Lee County's first hospital could be built. That spirit lives on. Through the decades, Lee Memorial Health System has served the community, saving lives and limbs, bringing babies into the world, and supporting families of those leaving the world.
I think it succeeded for a lot of different reasons, primarily from the leadership and from the building of teams of caring people. That's really what makes a health system. It's not the building.
Patients who entered Lee Memorial Health System knew they could rely on the doctors, nurses, staff, administrators, volunteers, and board members who all make the system run smoothly and provide excellent care for our community. In the 100 years since Sam Thompson had surgery for his appendicitis, countless thousands of patients have walked or limped or been wheeled or carried through the doors of Lee Memorial Health System.
Reminiscing is good, and it's wonderful to celebrate the 100th anniversary of Lee Memorial. But also what it really means to me is realizing that over these 100 years, we've been able to continue to serve our growing and challenging community without having to merge and become a part of a larger system. We've been able to care for people right here in our own community and to grow along with the community's growth.
Technology, communication, medicine, and transportation have changed since those early days of dirt roads and kerosene lamps. The dedication, compassion, and spirit have not. Not for 100 years and counting.